Hello, my name is Gemmy Cheung. I'm a retinal specialist and I work in Singapore at the Singapore National Eye Centre. And I'm also a research clinician scientist. So our research work is with the Singapore Eye Research Institute. My focus area are in retinal diseases, particularly those that are affecting Asian population. And I'd like to understand differences in phenotypes, their variation across different ethnicity, and to understand how patients respond to therapy, whether similarly or what drives any differences. I'm a medical retina specialist, so my main area in terms of the focus in disease is age-related macular degeneration, and if we go even more detailedly, is in particular the Asian subtype, which is called polypoidal choroidal vasculopathy. In terms of what approaches I use to study this condition, I am interested in a variety of approaches from epidemiology to clinical trials in particular, as well as many aspects of novel imaging. I think these past 10 to 20 years has been very exciting for macular conditions, particularly age-related macular degeneration. I think I've been very lucky to have been active during this time. So in particular, I'm very happy to see that our understanding of polypoidal choroidal vasculopathy, as well as Asian subtypes of age-related macular degeneration, have really advanced through this time. This includes our understanding of what the condition is. First of all, in the past, we thought it may be something very distinct from age-related macular degeneration, but now our understanding has evolved, and we seem to believe that this is actually a subtype of age-related macular degeneration as well. And very importantly, in terms of treatment, because that is going to affect our patients' visual outcome. Again, in the past, we relied on laser photocoagulation and subsequently photodynamic therapy, PDT, for PCV. But over the past 10 years or so, we've seen multiple successful clinical trials evaluating anti-VEGF in PCV and demonstrating very good and promising results as well. So I think that's another area that has impacted on the life of patients with PCV. A further area I think is also very important is, although we know that PCV is more common in the East Asian population, it is not that rare in the European descent patients as well. So one of my interest area is to collaborate with our colleagues from around the world. I've collaborated with colleagues from UK, from Europe, from US, and we like to understand how the phenotype varies, as well as whether treatment response differ. And so in that sense, our understanding from the different continents can advance and help all our colleagues from around the world. Okay, probably my children. But coming back to our career, I would say actually I've been very lucky. There has been many colleagues, as well as teachers, as well as mentors who have helped me through my career. If I may, I wouldn't just stop at one, but several important people include Professor Yang, who trained me when I was a fellow and really started my understanding in clinical trial and get involved in that area. Professor Storengi, I went to visit him in Milan and spent a few months there when I was fellow, and that was really instrumental in starting my interest in retinal imaging. And then subsequently, after I've moved to Singapore, I have enjoyed continuous strong support from Professor Wong Tian Yin, who really saw me through from a very young budding someone interested in doing some research to being able to establish my program. And more recently, I know this is the fourth already, but I must say, more recently, I have also been very lucky to have Professor Usha Chakravarti from the UK, and she has been really in the role of a mentor and teaching me and supporting me in multiple aspects, from clinical, technical aspects to personal development and career development. So I think all of us should be so grateful for all the support that we receive from everyone around us. My greatest professional achievement, again, I think I have been very lucky to have had many opportunities. But if I were to pick one right now, I would say that this year I will be the Congress President of the Asia Pacific Vitreoretinal Society Congress. So if I may, at the same time, I'd like to invite all the viewers to come and join us in Singapore in November this year. But I think why this is it means a lot to me is that it really culminates from years of collaboration and friendship and collegiate work together with colleagues from around our region, as well as reaching out to beyond Asia Pacific. So yeah, I think I would put that right now. And obviously, it is a big task ahead for me. So that is what I'm thinking of right now. I think having a international perspective is crucial for our day-to-day practice. Obviously, it keeps us up to date with what is the latest development. Being in Singapore and perhaps also much of Asia Pacific, we may not be the most up to date in terms of the newest developments in, for example, the next therapy out there. So having an understanding of what is up and coming and the new ideas that is being generated and tested is important, so that we can liaise that back to our patient about what is on the horizon. Secondly, is that in terms of treatment experience, treatment outcome, whether good or bad or concerns, as well as how we implement new therapies in terms of very logistic areas such as clinical pathways. So all of these are, whenever it's new, it is very useful to talk to our colleagues from around the world and understand and learn from their experiences as well as their recommendations. For me, I would rate my professional life 7 out of 10. I think it helps me define my role in society, and it keeps my mind active through the day. And I hope that through my work, and especially through my interaction with my patients, that really brings meaning to both myself and my patients. And when my children talk to me, I explain to them what I do, I feel that they also get that aspect, and that means a lot to me. When I manage to find the time, I'd like to relax and take a relaxing walk. We have very nice seaside in Singapore, so that's nice to take a walk and maybe just gentle exercise such as doing a bicycle ride. I'd also like do very relaxing things like maybe even watching a movie. So very simple hobbies. I would really love to be able to have regenerative therapy for patients that will probably be in the form of cell replacement therapy, because current therapies are very good at mitigating the damage done by diseases, but still we see a lot of end stage damage that current therapy does not address. So yeah, for me, what I would wish for is regeneration or rejuvenation. Who doesn't want to get younger?